I'm going to call to order the Eureka Springs Hospital Commission's regular meeting on this December 20th, 2021 at 6 p.m. Let's do a roll call.
Kent Turner, Treasurer.
David Carlisle, present.
Angie Shaw, CEO.
April Griffith, Secretary.
Barbara Dix, Vice Chair.
Judy Giggy.
And I'm here, Ty Burden, and then we have Bill Couch, who is on Zoom with us tonight. Has everyone had a chance to read the minutes of the regular meeting from November 15th, 2021?
Yes.
If so, may I have a motion to approve the minutes as written?
So moved.
Second.
Thank you. All of those in favor say aye.
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 All of those opposed? So the motion passes to accept the minutes as written. Do we have a public comment tonight? Anybody want to give public comment? Okay, go ahead and approach the mic. Ron, can you turn the public comment mic on for us?
Yeah, I don't think it's up.
Oh,
It's not coming through.
okay. I can hear you, yeah.
Yeah.
I'll try to repeat.
Come closer.
Yeah, just move on up to, yeah, that's right.
Sure.
That would be good.
Oh,
Okay.
okay.
Could you state your name?
My name is James Shaw,
Okay.
S-H-A-R-P. I have a series of questions.
You can ask questions in public comment. We just take comments. It's not usual to answer questions one-on-one. Afterwards, if you would like, I could myself. Sure, and I'd probably, Angie Shaw and myself could meet with you afterwards and answer your questions directly.
Okay, here's the deal.
Okay.
You all signed a contract with somebody called a liar, correct?
In the past, yes.
In the past.
And you've since taken that back from them.
I'm sorry.
You've taken control of the hospital back.
Oh, yes.
The question is, have you also taken our medical records back from a liar?
They never had your medical records.
Yes, they did. Because when I called to find out about my blood type, I was informed that the hospital only had records as of January 2020, because the rest of the records were at that line.
Okay. There must be some point of confusion
There
there,
must
but
be.
definitely Angie and I can meet with you on that afterwards and hammer that out.
I think it needs to be part of public record.
Okay, it is.
There are different laws involved with this. If, like, medical records are in the hands of people who are not by law responsible to have those, then I think that's a grave issue.
Sure.
We have,
Right.
I would just say I would be glad to talk to you about this after the meeting because
Yeah,
I believe that's the misinformation that was given to you.
Yes, I can assure you,
From your own staff.
yeah, there must have been a miscommunication. I can assure you your medical records are safe.
In that case, they should have been able to answer my question. which is
They
what
should.
the blood type, because you gave me a transfusion.
Right.
I was
I-
informed that you could not give me that information because that information was not available.
Yeah, it sounds like there's a grave miscommunication. I do apologize, but I'm almost certain we can work this out.
Okay.
Okay, thank you so much, James. Appreciate it. Okay, next, treasurer's report.
You can all follow along on your sheet. Checking account balance, we had no checks written this month, so the ending balance from last month is the same as the ending balance for the end of November, $16,901 and a penny. The money market had interest of $416.77, which leaves us a balance at 11/30 of $1,449,175.63. The CD only earns interest quarterly, so there was no change in the balance, and it remains at $437,999.76.
Does anyone have any questions for Kent concerning the treasurer's report? If not, we'll move on to committee reports. I really haven't had much activity this month with Quad C, which we can discuss later. Is there a report from finance?
No, they're just continuing to battle through, which is good.
Okay, good. And then marketing? Any report? No.
Oh, she resigned from marketing.
Oh, she did. I was not aware of that. Okay, very good. And we don't have a new person yet for marketing. Okay, very good. Then in that case, we will move on to the CEO report.
Okay. All right, just give you an update currently on COVID-19 at the hospital. Since December 1st, we've completed over 170 tests to date. And out of those 170, we've had 25 positive. We haven't seen a big increase of testing since the new came out. We have seen an increase in booster vaccines for both Moderna and Pfizer. And so we're continuing to see a rise on those every Friday when we do the clinics. We are carrying the pediatric Pfizer, and we have held two vaccine clinics at the Eureka Springs schools for that. And then we have another one coming up in January. Nursing administration is continuing to manage through our nurse shortage. Of course, we continue to post job openings on all social medias and Indeed to try to get nursing staff back in. We've also reached out to nursing agencies to inquire about nursing staff assignments and contracts to see if that is an option for us. Our respiratory therapy department, Greg and Brian, they continue to cover their department 24/7, as well as they are helping out in other departments as needed. In fact, Greg has been instrumental in helping with our ER remodel as well. Our compliance officer is currently reviewing our critical access rules and regulations. She has set up infection control training manuals and is starting to go into state and federal reporting guidelines to make sure that the hospital stays compliant. Hospital admissions were up by 3% in November compared to previous months, and we are up 12% for the year. The ER census is remaining to stay steady. We continue to trend record numbers each month. We've had an increase of 12% this past November compared to 2020, and year-to-date ER usage is up 16%. Radiology, outpatient CT referrals have dropped. This is due to loss of clinicians in our area. We have reached out, our radiology director is reaching out to our local clinics to market our services and follow up on any needs that they should have to try to get those back up. Our clinic, we are continuing to move forward on the clinic at 25 Norris. There has been a delay due to Medicaid needing several new forms completed, so we're currently waiting for them to give us the go-ahead. Once we get that, we should be opening soon. We have all the equipment and everything is ready to go. It's just waiting on Medicaid at this point. The business office is currently reviewing billing procedures. They're also helping to set up billing protocols for the clinic, as well as working with MedHost, who does our hospital billing on a daily basis to make sure that is going smoothly. The medical records department is currently working on physician credentialing for updating New Year and making sure that that is all in order. And our HR department, as I've said, are working to get our open positions out there so people can see what we have available. I would like to announce that we do have a new marketer. We interviewed several candidates this past week, and we have settled on Samantha Jones, which I know most of us know. She is going to be coming to us full-time after the holidays. We're pretty excited for her to join our team.
Very good.
As you know, the ER has been going through a remodel. It is looking great. New paint, flooring. We did install new cabinetry to replace the damaged ones. Maintenance was able to install more electrical outlets, which is going to assist our ER staff in with patient care. And we did receive grants that have helped to cover that upgrade in there. Once the ER is completed, our next focus will be on flooring in the patient rooms and halls, followed by the flooring putting in radiology, CT, and surgery. Another good news is that we have hired a new housekeeper. So we have a housekeeper and a laundry person as well. And we also have a new IT employee that will be helping Drew, especially with all the expansion with the new clinic and the new services that will bring. We needed to increase that department. And just to get everybody ready, next week is always a big week for us at the hospital. It's inventory week. We have to do all the counts of any inventory supplies that we have for the 31st, so we will be busy. Any questions for me?
I do. I don't know if this is time to ask them or not, but on the Friday clinics, are they at the hospital or at the clinic across the street?
They're at the clinic across the street.
Okay, and what are the hours on that?
It's usually 10 to 1.
10 to 1?
Every Friday. Now, this Friday will be Christmas Eve, and we will not have a clinic this Friday.
No clinic this Friday. And do they have to call ahead of time for appointment?
We just take walk-ins.
You do take walk-ins. I've had 2 people this week try to tell me they can't get any appointments to get their booster shot, and I told them they were there, and they said, well, yeah, but we can't get an appointment. I said, I don't think you need them, so.
Nope, you
no
just walk
appointment
in.
needed. And the other thing is, just for my own curiosity, is what kind of surgeries are we doing nowadays here?
Right now, we're just doing endoscopies, so colonoscopies and EGDs.
Okay, because I read that, and I thought, oh, I didn't think we were doing any surgeries. Okay, thank you.
The IT, is it just IT assistant?
Yes.
Okay.
Yes.
Okay, any other questions for Angie on the CEO report? Okay, with that, we'll move on to Bill Couch and the CFO report. Bill, you're up.
All right, thank you. Can you hear me?
Yes, sir.
Yes.
Very good. All right, I apologize. I issued 2 reports. There was like a 5 or 6 page report and then a 1-page report. Did everybody get all of that? Okay.
Yes.
Very good. Our bank balances, from a strict cash standpoint, we were at 1.508 million. We decreased that by $8,060 from last month. So pretty consistent in the great scheme of things. So I'm pleased with that. So we did not dip into any reserves for the month of November. Moving on to our balance sheet, I want to point out some items that until last month were not able to change.
Hey, Bill. Hey,
Yes.
Can you hold your microphone up again? That seemed to help. You're cutting out a bit.
All right, is that better?
Yes, much better.
Okay, I'm sorry. Patient accounts receivable on our balance sheet on the next page has to do with the fact that you see a figure there for this month of $1.81 million. That is netted by the allowances for for contractual adjustments for our payers such as Medicare, Medicaid primarily, and then Blue Cross and the other insurance companies.
We're kind of losing you again. I'm so sorry.
I'll slow down.
Okay.
And then
Well, the slowing down isn't as much of the problem as the mic doesn't seem to be in the right position. It's not picking up.
well, and that, no, it's not that, I assure you. It's
Oh, okay.
the
Something.
technology. The technology is not what it,
That connection is really slow tonight too, so
Oh, okay, so I guess the bandwidth at the auditorium's low is part of the problem.
upload speeds are like 1 megabyte.
Okay. Well, I heard 1.8 in contractuals. Is that right? Oh, we can't hear you at all now.
No.
Can't hear anything. Sorry, Bill, there's just nothing coming across. Okay. Bill, I'm going to try to call you, okay?
We got a thumbs up.
Okay, I can hear you. Let me put you on speaker. Yeah, I hear you.
All right, very good. No, I wanted to point out that the $1.8 million in patient accounts receivable is netted by $2.1 million of allowances for contractual adjustments, such as those that Medicare does not pay us 100% of what we charge. Same thing for Medicaid, Blue Cross, and so on, and et cetera. So that the 1.8 million is a net figure. Then you have the allowance for bad debts, which is against the total accounts receivable. So that when we bring that all down to net, now, we started reporting that last month.
Mute where?
Last month we were able to do so. And then, we had, prior to that, we were unable to do so. So in the last 2 months, we have been able to, in October and November, we've been able to report that net of those allowances. So I'll point that out to you that prior to that, we had just been rocking along with whatever balances we were able to put together on a cash basis. We're trying to convert to the accrual basis, which is the true way of accounting for everything according to the AICPA, American Institute of Certified Public Accountants. So we move on. The thing that I must point out is that we have no debt on our liabilities section of our balance sheet, and our comparative month-by-month income statement. You'll note up until October, it's really easy to see. When you scan down from the top, you'll come down to about a third of the way down the page, and then you'll finally see bad debt expense. And that becomes a true figure at that point in time. We come down for the month, we're showing a negative $95,782. And the first thing you would draw from that is, well, we lost $95,000 for the month. The last item that I'm not able to report to you is our cost report effect. And that is what we are owed by Medicare and Medicaid as a result of our cost report. So we hope to bring that to you and have a true accrual basis financial statement in the near future. It will be in the next fiscal year. The next page that our revenue usage report, our summary, we're showing for the month of November $1,468,491 of gross revenue. That is the highest month to report in the 11 months presented to you. And I dare say it's the highest month since we took over operations February the 1st of 2020. So I'm very pleased with that number. Then there's a separate report that I want to point out to you is the one-page report of our income statement. Again, it shows a terrible loss year-to-date of $3.2 million, but most of that is the correction for the conversion to the accrual basis for accounts receivable of almost $3 million, $2.8 million. But that does not reflect our cost report position for the two cost reports that we have filed that we are responsible for. The 13-month period ending 1/31/20 and the 11-month period ending 12/31/20. Those two items are $2.6 million that are not reflected because there is a negative $1,085,000 reflected on the general ledger as it stands today. So $2.6 million with no provision for any effect from the 2021 cost report position, which will be a receivable because of the activity of our increased expenses that we've incurred year to date. So once we get that corrected, and we will by the end of the year, the situation is, I think, we're in pretty good position as I relate to all the small rural critical access hospitals that I deal with.
Okay, Bill, that was very good. Let me try.
Questions or concerns that I may address?
Let me try to summarize just a little bit and see if I'm interpreting what you said correctly, okay? And if not, that's fine. Explain where I'm going wrong. So basically you say on the accounting to date, we're at negative 3.2. That doesn't take into account the cost report of the prior year's 2.6. And so that leftover, say, 0.6, is going to be going on the cost report for 2021. Is that about right?
Correct.
Okay.
It should be showing up as a receivable on the 2021 report, correct?
Yes.
Yes. So actually, that's a very good position to be in as we look about the prior years were like 1.2, 1 point, et cetera. So just here in November to be at 0.6 shows just, how well we're doing in a way as compared to even the more recent years for ourselves. Would you agree with that statement?
Yes, sir.
Okay. All right. Now, does anybody else have any other questions or concerns or comments that they would like to make concerning the finances of the hospital?
I get happier and happier by the day.
Thank you, Kent. I really appreciate that.
It's our job to make you happy.
It is. Okay, I think that's it, Bill. We really appreciate you. I'm probably going to go ahead and turn the phone off. Hopefully you can hear me from there.
Yeah, I'll listen in.
Okay. Okay. So our next item on the agenda is the chairperson election. As I think almost all of you know, I will be resigning at the end of the month as we're moving. And as our bylaws indicate, we do need to have an election. The vice chair, it was decided, does not automatically go into that position from prior bylaw decisions. And so tonight, I would like to have an election for the chairperson that will start next year. And so with that, can I ask if there are any nominations for chairperson?
Mr. Chairman, I nominate Barbara Dix as chairman, the current vice chair.
Okay. Do I have, let's see here, any other nominations? Okay, seeing as there are no other nominations, can I get I think I need a motion for this. Can I get a motion to make Barbara Dix the chairperson for the upcoming year 2022?
So moved.
Second?
Second. All of those in favor say aye.
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 All of those opposed? Okay, so it passes. So Barbara, you will be our next chairperson for the coming year.
Oh, goody. And it will be a one-year term.
Would it? I was just thinking about that, and I was like, I probably should have looked that up before, but yeah, I don't know.
Well, it's filling your term, which was 2 years.
Okay,
And the treasurer and secretary are 2-year terms, so everything
Okay.
will be up.
so there will be another election. Okay,
This time next year.
this time next year. Okay, very good, and I will let you guys decide how it goes forward from there. Okay, so now we move to the final items, which are the commissioners' comments. Kent, do you have any comment tonight?
No, except I continue to get good reports, particularly on people that are being treated in the ER. I got 2 just in the last week, both very favorable. I do stress, though, that I'm telling everybody that they should fill out their surveys. I need to make sure those surveys are going out, because I am having people still tell me that they're not getting surveys.
Okay.
But
Okay.
we don't need to pass surveys with good comments up.
Yes, I agree. David?
I'm just glad to be here, and
We're glad you're here.
comment about services. I was tested for COVID a couple of days ago, and that was pretty efficient.
Good.
And the person that was doing it seemed to do a really good job. Thank you.
Okay, April, any comment?
No comment.
Okay, Judy?
No, I guess the only thing I'm going to say is follow up on what I was talking about before with the clinics. What if they need to get tested because they've been around somebody, where do they go for that?
We test at the hospital. It's usually Monday through Friday. We do outpatient testing from 8 to 4.
8 to 4, Monday through Friday?
If it's on the weekend, they usually check in as an ER patient and is tested through the ER.
Okay.
Having just been through that, because I got a cold and thought I should be tested, you go up to the hospital and you call them. You tell them you're waiting in your car, and they come right out to you.
Oh, really?
Yes,
Yeah.
that is exactly
Really
it.
efficient.
It's very
You just call the
efficient.
regular number?
You just call the hospital
Yeah, because
number.
I'm hearing people say, oh, there's no place to do this, and I haven't had the need for it, so I really didn't know.
The operator takes every bit of the information that you need taken,
8
right?
to 4.
You don't even have to talk to another person.
Call hospital when
Pretty
you get to, when you're sitting right out front of the,
Downtown.
Yeah,
7,400.
and I would just add to that, it is getting difficult to get a test, and they're selling out in a lot of places, and in the community and surrounding communities, it is getting more and more difficult, but the hospital's done very well. You can get a test at the hospital, so that's been great.
and they just call the main number.
Yep.
Main number, when you're in the
Main
parking
number.
lot.
Yeah, that's what I.
When you're in the parking lot,
That's what I'm
call
going
the
to
main
call hospital from your car, in the
From your
parking
Your
lot.
car, and they come out and they test you at your car, and then they will call you back with the results.
And how long
Whether-
does that usually take?
20, 25 minutes.
Well, they
Oh,
actually tell you that you can actually wait for the quick results, which I did, and
Oh,
then
okay.
they call you back. They also do the long results. They call you back.
Well, I've got
I think got 48
got-
hours, 24
Yeah,
hours.
it's usually
two
24
people
hours.
that
I haven't gotten
I've
my
got 2
PCR
people that
back.
work for me that,
Some of them
one
have
hasn't
been
had any shot.
taking a
He
little
doesn't know
longer.
where to go.
I think
Okay.
it's
It
because
may be
there's
just
just
fresh.
an increase.
The other one,
Yeah.
he doesn't know where to get the booster, so,
Yeah.
Right. Well,
This is just the COVID test itself that we're talking about.
yeah.
But in
Yeah.
Fridays, they can get
They
the
can get the
shots.
boost, yeah, I got that earlier, yeah. Okay,
Good.
thanks.
Sure. Barbara, any comment?
The only thing, because it's getting cold, for the new people, typically if the school is closed because of weather, then we don't have a meeting, unless the roads are perfectly clear and the school's closed anyway. But we just communicate that day, and Kim has to know by noon on Monday and Friday by noon for the workshops. But if weather's bad enough for school to close, we usually don't have a meeting.
Okay, that's a good update. Okay, well, you know you weren't going to get rid of me without some comments, so let me go ahead. I'll make this as brief as I can. I just wanted to thank everybody on the commission for their participation in achieving many of the goals that we set forth this past year. I'd also like to extend my thanks to all of the staff who supported us through those efforts. I believe that 2021 was a year of surprises, and it was a year of some disappointments, as COVID in the form of Delta rose once again to ruin our intentions to return to normalcy. For the hospital, as 2020 was the year of division over masks, I believe 2021 turned out to be the year of division over vaccine. Let the record show that as an institution, we did promote the vaccine and scientific recommendations to the best of our ability. We have delivered literally thousands of vaccines at no cost to the patient. We've encouraged staff to receive the vaccine as best we could. I think the number of COVID cases in the immediate community as well as in the hospital will show that indeed we did save many lives through this effort. On the eve of the Omicron variant, we're still unsure what the future will bring. No doubt we as a community will need to be watchful and take scientific and governmental recommendations seriously. Although our current vaccine seems not to perform as well against this variant, the 3-shot series of either Moderna or Pfizer currently stands as our best tool against Omicron. Now that I'm leaving the hospital commission, and for at least the time being leaving medicine in general, I would like to clarify a few items that have been brought to my attention by several patients. First, the hospital does not receive extra money for COVID cases on a case-by-case basis. Second, we do not receive any monetary benefit from promoting the vaccine. In fact, delivering the vaccine to the citizens has cost the hospital a great deal. Third, the vaccine does not and cannot give you COVID, as it is not a live virus. I've also never personally seen any evidence that COVID is part of a larger conspiracy created by Big Pharma. Lastly, I want to clarify that I have never been offered reimbursement or heard of any physician being offered money or any other type of remuneration for putting COVID-19 on a death certificate. Along this same line, I would also like to remind everyone that the commissioners here are serving on a volunteer basis. I have never worked for the hospital. I've never received any type of income or payment from the hospital. And as I am aware, this fact is the same for every member of this commission. I would also like to say that this commission has successfully brought the hospital into the hands of the citizens of Eureka Springs. In the future, it will take time and effort by those citizens to continue to make the hospital a success. Thus far, we have had many successes by not only offering new services, but also making the hospital physically sound, as we just heard, while significantly increasing wages at the hospital. Already, the hospital is beginning to undergo a major facelift to its structure, and I am very, very excited to see what this commission is able to accomplish in the coming year. So I must say goodbye for now. I've enjoyed my time on this commission and have learned a great deal. I wish you all a Merry Christmas and a very Happy New Year. Can I get a motion for adjournment?
Well,
We need one item. We need
Oh,
to
sorry.
determine when our next workshop. I'm going to
Okay.
suggest the 15th of January. You should be back by the 15th, I think you said. That's
good for you, April? Okay,
Okay.
that's great.
So workshop 15th of January 2022. Do we have a time and place yet, or
main stage, noon, 12 o'clock,
main stage at noon?
noon.
Okay, and I want to thank you for taking us by the hand and being a great leader this last year. You've really led us through some hard times and fun times.
Thank you. I appreciate that.
Yes.
I do.
Here, here.
Thanks. Can I get a move for adjournment? Motion for adjournment?
So moved.
All those in favor say aye.
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 We are adjourned.